Hi, everybody. I'm Dr. Olson, and today I want to talk about detailed clinical progress notes and where is the information. Disclaimer, as always, I am a senior AME and a HIMSS AME, and I am speaking on behalf of myself and my many years of experience working with pilots, and I'm not speaking on behalf of the FAA. Today is March 14th, 2024, so let's get into it. Okay, so a pilot gets this letter from the FAA, and this pilot has a history of anxiety and is on special issuance because of that history. Now, the requirements of the special issuance letter from the FAA indicates a detailed clinical progress note. Now, this is a very specific term. A progress note is a true medical term. And when you go in to see your doctor and that doctor generates a note after they've seen you, it's considered a progress note. The FAA used to use the term current status report. That's a little bit more vague. It's not really a true medical term. So they're shifting to actually request a true medical document from you produced by your treating provider. Okay. So what the FAA is trying to do is they're trying to cover their decision to medically certify a pilot, and they want to base that on the clinical records. So hence the detailed clinical progress note. The information, if you're comparing a quote unquote current status report versus the detailed clinical progress note, they're going to have more robust information if they're actually getting their medical record to be able to make their decisions. Now, this pilot's letter happened to not include the guidelines for this detailed clinical progress note. Sometimes that happens. So hence, we're saying, where is the information? So we can also say that this goes both ways. The pilot is wondering where the guidelines are. They didn't get it in their letter. But the FAA is wondering where is a letter with the details of your medical condition. So let's talk about what the FAA wants first and how they present it to the pilot. And then we can talk about where you, the pilot, can get this information if perhaps you don't receive it in your letter. Okay, so what information does the FAA need in the detailed clinical progress note? Basically, what the FAA wants to know is the current status of your condition. And the first part that they want is a summary of your condition. And this will provide the FAA with any changes to your condition since the last time they've received that information. So in this case, we would say an interim history. But of course, if this is the first time that they're getting this info from you, then they're going to be getting hopefully your whole history, or at least a summary of your history from your doctor. The next thing that they want in this note is a list of your medications. And most importantly with this, they want to know what the side effects are. And that's pretty important to the FAA because if you're having, say, lightheadedness or dizziness in the cockpit from your medications, not a good scenario, right? The next thing that they're going to want is any physical exam findings. Now, this may not be pertinent in certain settings, and the reason I've chosen the letter from the pilot that I presented in the previous slide is because this pilot's required to see a psychiatrist. Psychiatrists don't always perform a physical exam when they see a patient. So the FAA, even though they've listed this as part of the detailed clinical progress note, it may not be expected by the FAA in certain settings, okay? The next thing that they want is results of any testing, and they also want to know what your diagnosis is. If this is interim history, if your diagnosis has changed, well, that's going to be pertinent to the FAA, and they're certainly going to want to know about it. And then finally, what they're going to want to know about is your doctor's plan for your care and any recommended follow-up. Now, all of this boils down to the expert opinion of your doctor, which is what the FAA is going to rely on. Now, you can think about this from a legal perspective. If a pilot wants to challenge the FAA's decision about medical certification, the FAA will need legal standing for their decision, and hence the expert opinion of your doctor really counts. So let's go ahead and let's take a look at the FAA document that the FAA provides for pilots. Okay, so here it is. This is a really busy slide, but I'm going to break it down here into some very basic things. So the first thing that you can see here is this document is 2 pages long. Page 1 is on the left and page 2 is on the right. Now on page 1 you can see on the left side there's a column. This is the description of what an after visit summary is, okay? An after visit summary is not what the FAA wants, okay? If you print up an after visit summary and supply it to the FAA, it's not going to be sufficient, and they're going to ask for a current detailed clinical progress note, okay? Now, the column on the right is the description of the information that is within a detailed clinical progress note, okay? So they're just kind of describing it a little bit to you. Now, the term current detailed clinical progress note, they're defining it on page 2 here, okay? So let's talk about this. Now, current is a term that I've talked about in one of my previous videos. It's the video on the FAA medical certification process from the 30,000 foot perspective, okay? But current means within 90 days of the date of your flight physical, okay? The other thing that they say in here is they want it to be your treating physician. So don't go see a new provider if you can help it. I mean, if your current provider decides to retire, or if they unfortunately would pass away and you have to go to somebody new, that's the way that it is. But don't avoid seeing your treating provider to try and get this note produced. So the next part of their term, detailed. Okay, detailed means that it should include some of these items, if not all of these items. Now, this is a list of what I just went through on the previous slide. And these are the items that are generally included in a general progress note produced by your doctor. Okay. The next term, clinical. Clinical means that it's an actual clinical encounter, so that you and your doctor meet. Your doctor, if they're going to perform a physical, they're performing a physical. If they're taking your vital signs, they're taking your vital signs. So you want to actually see your doctor for this visit. And then progress note. Okay, progress note is an actual part of your medical record. An after visit summary really isn't, but that progress note is going to be part of your medical record. And then finally, something very important. It must specifically include, if this language is in your letter, it specifically needs to be addressed by your doctor, okay? So don't ignore that. Now, if you have this document with you and you share this with your doctor, and I encourage you to do so, there are 2 main portions of this letter that you should share with your doctor. The first is, it must specifically include. If it's got it, you got to address it, okay? Your doctor needs to address it. And the second thing is what the details are of this progress note. The FAA wants to see these things. If your doctor is able to produce it, then they should produce it, and it should be part of that note that you bring in to supply to the FAA, okay? So set up an appointment with your doctor within 90 days of your AME visit. I know this is tough with scheduling sometimes, but try and do that. And make sure that it's with your treating physician. Make sure that's an actual visit, and make sure that you share these 2 very important components with your doctor. So, if you receive a letter from the FAA requesting a current detailed clinical progress note, and by chance the document or the form is not included with that letter, then you may need to try and search this out on your own. So what I've done here is I've provided a link in the description of this video, and this is what that link will look like to that current detailed clinical progress note document that the FAA produces. The other thing that you could do is you could search FAA AME Guide Current Detailed Clinical Progress Note, and you should be able to find it that way. Most importantly, I'm going to reiterate this again, share this form and the letter that you receive with your doctor so that they're very aware of what needs to be included in this note to be able to supply to the FAA. So that's it regarding current detailed clinical progress notes. Thanks for watching. If you would like to, please subscribe and please share this YouTube channel with your colleagues so that they can join in on conversation. And as always, subscribers out there, if you would like to suggest a topic, please send me an email or leave a comment. Thanks for watching. Have a great day, and I'll see you next time.